Okay, let's dive right in. Welcome to today's explainer. We're actually going to do something a little bit different today. If you, or maybe someone you know, is struggling right now, I'm going to guide you through an interactive, step-by-step medical screening. This is derived directly from medical professionals, and it's really designed to help you understand what's actually happening beneath the surface. I want you to put your hand on your chest for just a second. Seriously, take a moment and really ask yourself this question. Are you carrying a weight that you haven't told anyone about? Because, bearing this burden alone is so much heavier than you might realize. And unfortunately, it is incredibly common to try and hide it. And there's a pretty tragic reality we have to face here. 60% of sufferers, that's literally 3 out of every 5 people with depression, never seek professional help. They just don't go to a doctor. This leaves massive numbers of people fighting this invisible, totally exhausting battle without any clinical support at all, just thinking they have to tough it out. Section 1, Understanding Depression's True Nature. Before we jump into our screening today, we really need to completely reset how we think about this condition and just dismantle the stigma surrounding it. So here is the absolute crucial point. Depression is never a personal feeling. In Japanese culture, there's this word sometimes used to dismiss these feelings, amai. It basically implies a sort of weakness or laziness or overdependence. Well, we need to throw that concept entirely out the window. This condition is definitively a structural abnormality. It's a physical brain disease, guys, not some lack of willpower. Now, what's really fascinating and scary is how this illness hides. We naturally expect depression to just look like sadness, right? But it frequently masks itself behind purely physical symptoms. We're talking dizziness, heart palpitations that make working literally impossible, stomach aches, chronic diarrhea, or even unexplained shortness of breath. It's a total master of disguise, honestly, fooling both patients and doctors into treating the stomach or the heart rather than the brain itself. And we simply cannot ignore the scale of this. There's a 10% lifetime risk of developing this disease, meaning it affects at least 1 in 10 people you know. To put that into perspective, for women, that risk is actually twice as high. We absolutely must take this seriously, not just because it's super common, but because it is lethal. Over a third of individuals experiencing suicidal thoughts are battling this very illness. Moving on to Section 2, the quick 2-question screen. Think of this as our initial triage stage. I'm going to ask you 2 questions, and I want you to answer yes or no based strictly on your experiences over the past month. So take a slow breath and answer honestly for me. Step 1. Over the last month, have you frequently felt down or deeply depressed? And step 2. Over that same month, have you completely lost interest or joy in the hobbies and things you used to love? I mean, even things like playing with a pet or seeing your grandchildren. Do they suddenly just feel like a chore? Now look, everyone has bad days. You might get a bad review at work and feel terrible about it. But here's the key difference. Normal sadness recovers with rest. You eat a good meal, you get a good night's sleep, and you bounce back, right? Depression stays down. If you answered yes to either of those 2 questions, and that feeling simply doesn't go away with rest, you really need to stay with me for this next step. Section 3, the 7-symptom deep dive. This is our 2-week checklist. So for those who said yes to our quick triage just now, we're going to look really closely at a specific, unified 2-week period using a 7-point medical checklist. Think back to that exact same 2-week window. First off, did you experience extreme changes in your appetite, like either completely stopping eating or suddenly overeating? Second, what about your sleep? Did you suffer from severe insomnia, maybe waking up way early and just staring at the ceiling? Or actually, on the flip side, did you sleep the entire day, just feeling heavy like mud? Moving down the checklist. Third, did your focus just completely vanish, making your normal work impossible? Fourth, were you constantly fatigued, like a state where even a whole weekend of resting completely failed to cure that deep exhaustion? And fifth, did you start intensely blaming yourself, feeling like your life just has absolutely no meaning or value anymore? Finally, number 6, did you notice physical restlessness, like pacing around, totally unable to sit still? Or conversely, mental freezing, where your thoughts just completely halt when someone asks you a simple question? And number 7, during those 2 weeks, did you genuinely wish you could just disappear from this world entirely? Okay, to summarize the medical rule here, if you experienced 4 or more of these 7 symptoms simultaneously during that exact same 2-week period, you likely meet the medical criteria for depression. It's not about having one symptom a month ago and another one today, right? It's really about that cluster of them hitting you all at once. Which brings us to Section 4, ruling out other conditions. Hitting those criteria is a vital realization, for sure, but it's actually not the end of the diagnostic journey. We have to rule out other conditions, most notably bipolar disorder. This is where someone experiences hidden manic episodes of extreme, totally abnormal energy. Like maybe for a week you felt invincible, stayed up all night, or racked up huge phone bills calling literally everyone you know. A lot of people mistakenly think this burst of abnormal energy is the real them finally recovering from depression, when in fact it's a completely different condition requiring a totally different approach. And honestly, this highlights exactly why seeing a medical doctor is absolutely necessary. Just look at these secondary causes. Physical issues like a thyroid hormone imbalance or even early-stage dementia can completely mimic these exact psychiatric symptoms. Your doctor has to rule out things like schizophrenia, OCD, and generalized anxiety to make sure you're getting the right care. You just cannot diagnose yourself in a vacuum. Section 5, Seeking Help and Treatment. So knowing all this, how do we actually turn this newfound understanding into compassionate action to help ourselves or the people we care about? I want to repeat this quote we pulled from our medical sources because it is literally the absolute core of our explainer today. It is a brain disease, not your fault. Do not suffer alone. This is not your weakness. You are not to blame for a structural abnormality in your brain. You must lean on medical professionals, your family, your loved ones. There's absolutely no shame in seeking out a clinic. If any of this resonated with you today, if you found yourself raising your hand during our screening, I want to leave you with this thought. Knowing what you know right now, what exact action will you take today to reach out to a professional or a loved one and finally prioritize your healing? Please don't let the invisible battle stay invisible. Thanks so much for joining me on this explainer, and take care of yourselves out there.